Okay, so due to some family circumstances, she's not able to be with us. So I agreed I would step in since I was in the session anyway. So she's more than happy to take any questions, and I'm happy to take those back on your behalf, or if not, the email address for Julie is on here. So as the title suggests, this is a piece of work that was conducted by two colleagues, Julie, Amy and Deborah. And this piece of work was classed as a pilot study within one English National Health Service Trust. So within the UK, we have our provision of services split up under the NHS, the National Health Service, and one of those trusts asked the three of them to conduct an evaluation of a pilot piece of work which they had conducted, with the focus on thinking whether this could be rolled out across the whole of the trust, which is very common practice within the UK, where in terms of conducting a pilot. So my colleagues were asked to conduct this evaluation, and the slides I'm going to go through talk about what they were asked to evaluate, how they went about it, and also some of the findings for it. And my colleague's going to hold up the timing for me, aren't you? Okay. So I'm presuming that quite a number of you in the room are clinicians in some form or other. So safeguarding perhaps is not a term that you're not familiar with. So in terms of where we may have instances where patients may disclose, or where you have something that you have a concern about their well-being or in terms of their family. So in the UK we refer that as safeguarding. And under our NICE guidelines, so our National Institute of Care Excellence guidelines, it is the responsibility of every clinician that has a contact with a patient to be aware and escalate any safeguarding issues. So it is something that all clinicians are trained for during their pre-registration training, and also it's an expectation that you would know what the guidelines are, and it's part of mandatory training is safeguarding across all of our trusts. However, whilst clinicians are mandated to undergo training, what doesn't happen is what we call clinical supervision. And again, that might be a familiar term with a number of you here, where you have clinical supervision in a range of different aspects. What the pilot was looking at is whether they develop clinical supervision around safeguarding, an opportunity for people to talk with colleagues about instances where safeguarding had been raised, but also what were the practical things and also the support for them as clinicians. And that was what the pilot was about. Okay. So clinical supervision is recognised as something that's very important for all clinicians when they're practising, but it hasn't been used in the context of safeguarding, and that's why they were doing it as a pilot, and it was asked to be evaluated. Okay. So this was a pilot that was conducted in one aspect of one trust, and it was within children and adolescent services, which covers a whole range of things, covering mental health services, covering a number of different wards. So that has about 400 members of staff. So 400 staff are deemed to be working in these particular types of settings. And what they were wanting to do is to evaluate this clinical supervision that had been delivered to these staff, and then evaluate in terms of what their feelings were, in terms of how it supported them, in terms of their understanding of issues and how they may go forward in terms of good practice. So they had something called a safeguarding supervision framework. So we'll call that the SSF. And this was a framework of input that was given to staff, but also training and ongoing resources. And it was that framework which was the basis for the evaluation. And what they were actually interested in is, as it says on here, this evaluation study had the following research questions. How was this framework, this SSF, operationalised in practice by supervisors? So how were supervisors within this area of children and adult services were actually supporting their staff that were frontline staff? And how do supervisees experience this process, including the barriers or enablers for this support to be there in place? Because as we know, in clinical practice, they're very busy places, 24/7. You do it within the UK. A lot of our working on wards tends to be long shifts, 12 hours. We've had a move towards changing the level of shifts for a number of our nursing staff in particular. And so within there, working in very busy environments, it's how you build in time to have the clinical supervision around safeguarding. So they conducted the pilot using a survey. So a survey would administer to a range of the 400 staff that were working within this one particular setting. And as you can see through here, the normal things in terms of the age, the consent, ethical approvals, etc. were all obtained. 142 individuals completed the survey, which obviously was anonymised, and they had it across a range of bands. So bands is how the different levels of responsibility from when you've just been qualified all the way up is what we refer them within the UK. So the results came across a whole range of different bands, those that have recently qualified, those that are long-standing and very experienced clinicians. The survey was carried out this year between April and June, and it was a briefish questionnaire because, again, those of us that researchers will know if you put a questionnaire together and it takes any longer than, quick that I can do over my coffee break, the chances are that you're going to get very little low returns if completion at all. So they deliberately made it to be shortish questionnaires, and there was also opportunity for them to add in narration so they could add in their own comments or feelings about this supervision and this framework. A colleague then did the necessary statistical analysis of this, of which I'm not going to go through all that word by word, and I know the presentation will be available later. And as I've mentioned, it had got some open-ended comments, which were also informed the feedback to the trust that commissioned this evaluation. Overall, the survey reported that actually the clinicians felt very confident and much more knowledgeable with the safeguarding supervisors and how the system was put into place. However, those that were on a lower band, and that may be that they've recently qualified or indeed had qualified quite a while ago but hadn't moved up the pay scale, thank you, actually felt more concerned about raising some of those safeguarding issues and how the pilot supervisory model was actually they were able to work within the confines that currently had. And that was something that's been fed back in terms of how that would be, we could support those lower band staff in terms of seeing any safeguarding issues and be able to discuss theirs with their supervisors. Okay. It didn't make any difference in terms of whether the age of those that completed the framework, nor about whether it's male or female, or indeed the length of time that they're actually practicing as a clinician. So there was a number of components that they fed back in terms of recommendations. So again, it was about the preparation, making sure that everybody had the buy-in in terms of how this model was going to be delivered. But that was not just by the supervisors, but those that were going to be part of the work itself, those that were going to be undertaking these clinical supervisions. But also looking at what best practice was in terms of delivering similar types of clinical supervision, whether it be for safeguarding or for other areas as well. Obviously, standard acknowledgement that the team would like to thank all those that completed the evaluation. A copy of the report has been sent to the trust, and on the basis of what the report and some feedback, which is where they are at the moment, the trust will then decide whether they're going to roll out clinical supervision across the whole of that particular trust. And I know the team are going to publish this in academic journals in terms of whether other trusts might want to do something similar, because again, safeguarding is something particularly within the UK is very much on the public agenda, and certainly within clinicians, where they have to have a responsibility in terms of escalating any safeguarding. And I'm hoping I've done full justice to Julie's presentation there. There's a whole range of references on there. So apologies that I can't particularly answer any direct questions, and I hope I did best justice to Julie. I'm sure I missed loads out, but there we go. Thank you.
We've got